Hello, dear students. My name is Medvedeva Anna Valentinovna. I am the assistant of professor in the pathological anatomy department of Saratov State Medical University. And today I will describe you the new theme about tumors. What's this tumors? Definition. We know synonyms of this term: neoplasm, blastoma. A tumor, it is a pathological process characterized by unstrained, quick and constant reproduction and growth of cells. Etiology of tumors. There are four main theories of their origin. Physicochemical theory, Virchow's theory, viral genetic or Silver's theory, oncogenetic or Cohnheim theory, and polyetiologic or Petrov's theory. More about each of them. Physicochemical theory, action of physical substances and chemical substances, or cancerogenic substances, which, as example, polycyclic carbohydrates as benz-alpha-pyren, in the cigarette smoking resins, aromatic amines can lead to cancer in the urinary bladder, cyclamate and saccharin in the cancers of GIT, aflatoxin, nitrosamines, nitrates, anti-cancer drugs, or cyclophosphamide. Asbestos can lead to cancer in the lung. There are cancerogenic substances, and maybe hormonal oncogenesis or chemical or hormonal substances. Those hormones can increase amount of those hormones can lead to cancer in some organs. For example, increased estrogens lead to endometrial carcinoma, as well as to breast cancer, but only in the experimental mice. Diethylstilbestrol can lead to vaginal carcinoma. Using steroids in the treatment can lead to adenoma of the liver. Which physical substances or physical oncogenesis? There are many substances, physical substances can lead to tumors in some organs. As example, ultraviolet radiation can lead to cancer in the skin or melanoma. X-ray radiation can lead to cancer of the skin and leukosis in the radiologists. Radioactive isotopes, radium to osteosarcoma, radioactive iodine, cancer of the thyroid gland, radioactive thorium to the liver sarcoma, and many others. What about viral genetic theory and viral oncogenesis? Some viruses can lead to some cancers, some tumors. As example, oncogenetic RNA viruses. As example, tumors connected with AIDS infection can lead to B-cell malignant lymphoma in the lymph nodes. Oncogenic DNA viruses, papillomavirus, can lead to the cancer of the cervix. Epstein-Barr virus can lead to special Burkitt's lymphoma. hepatitis B virus can lead to the liver carcinoma. What about main tumors characteristic features? Atypism, some growth or outward appearance, tumor borders, recurrences, metastasis, and influence of the microorganism. And more about each of those characteristics. At first, tumor's atypism. It's a tumor acquiring of the new properties uncharacteristic for the normal tissue and cells. We distinguish the following atypism types. Morphological, tissue and cellular. This type of atypism is more important for pathologists, for diagnosis, for pathological anatomy diagnosis. Functional, we see appearance of new function. Antigenic, we see new antigen characteristic, and this type of atypism we use to the immunohistochemistry. And metabolic. What about tissue atypism? Is characterized by derangement of size, form, tissue structure interaction. So we see appearance of node, for example, with a special form, round, oval, with some size, 5 centimeters, 10 centimeters, example, and new structures, more solid, more soft, with new special colors. In this photo you can see tumor in the stomach. We see plus tissue, appearance of the node under the mucous membrane of stomach. In this picture you can see fibroma, this benign tumor, but we see plus tissue and abnormal growth of connective fibers, not parallel. In this photo you can see papilloma, this benign tumor too, but we see plus tissue as a papillae, normal cells, but plus tissue and papillae growth. What about cellular atypism? We see polymorphism of the nuclei and the cells themselves. Nuclei size and quantity increase. Increase of nuclear cytoplasmic index to nuclear. The growth of size and increase number or quantity of nuclei. Hyperchromatism of the nuclei. Dark blue color or maybe dark gray and black color of nuclei as a result of increase of metabolism and presence of pathological mitosis. In this photo you can see scheme of benign and malignant tumors. Benign with similar cells and clear borders. Malignant with different cells, multinuclear, hyperchromical, and infiltrative growth. In those photos you can see abnormal cells with several nuclei and hyperchromical and large size and different forms. In those photos you can see pathological mitosis in this cell and in this cell. The next characteristic of tumors, tumor growth and borders. We told that benign tumor has clear borders and distinct borders. In the benign tumors, we see expansive growth, slow growth. As a result, the borders are distinct and clear. In contrast, fast or rapid growth, infiltrating growth, we see in the malignant tumors. As a result, the borders are indistinct. In this scheme, you can see in the left side benign tumor, we see clear borders, and the right side we see indistinct borders and malignant tumors. In this photo, you can see malignant tumor of adrenal glands with a different color and infiltrating growth. We see necrosis and hemorrhages. There are four main forms or shapes in all tumors. Tumor maybe as a node, as a cyst, as an infiltrate and ulcer. Node and cyst more often. Those forms we can see more often in the benign tumors. Infiltrate and ulcer is a malignant tumor. In this photo you can see ulcer. I think that this malignant tumor. This large cyst in the ovary, I think that benign tumor. In the hollow organ, with respect to the hollow organ, lumen, the tumor can be exophytic in the volume of hollow organ with a growth tumor in the volume. As a plaque, as a node, and endophytic. We see growth in the wall of hollow organ. In this photo you can see exophytic growth as a cauliflower. The next characteristic of tumor, recurrence or relapse. What's this? It's a repeated appearance of tumor after its excision, eradication or radiotherapy. Relapses or recurrences more often we see in the malignant tumors. And metastasis. Metastasis is a characteristic for malignant tumor only. What's this metastasis? It's transfer of tumoral cells with the blood or lymph flow from the primary node to the other organs and systems. Those tumoral cells give the start to the secondary or metastatic node's growth. Metastasis we see only in the malignant tumors. And metastasis is the variant of cellular embolism. Metastasis can be lymphogenic through lymph flow, hematogenic through blood flow, and in the body cavity dissemination, growth to the surrounding tissues. In this photo, you can see many metastatic nodes in the liver from GIT cancer. And the last characteristic of tumor, influence of the organism. Maybe local, maybe general. What means local? Tumor compression of surrounding tissues, the atrophy or tumor invasion into surrounding tissues with their destruction due to action of malignant tumors. And general influence, we say is an intoxication, only due to malignant tumors. In this table, you can see differential features of the benign and malignant tumors. We talked about all features. tissue atipism we see and in the benign and in the malignant tumors. Cellular atipism only in the malignant tumors. Growth of tumor in the benign tumor, expansive growth, in the malignant, infiltrating or destructing growth. As a result, borders in the benign tumors distinct, in the malignant tumors indistinct. Recurrences and metastasis we see only in the malignant tumors. Local influence to the macroorganism we see and in the benign tumors is the atrophy of surrounding tissue, and due to malignant tumors is a destruction and necrosis of surrounding tissues. And a general influence is cachexia, cancer cachexia we see only in the malignant tumors. Besides, the tumors with the local infiltrating growth, for example, basilioma or basal cell cancer, are distinguished. In those pictures, you can see abnormal atypical cells. The next information about tumors and nomenclature. For benign tumors, for all benign tumors, we use name in Latin or Greek, tissue name in Latin or Greek, plus oma. For malignant epithelial tumors, name of tissue in Latin or Greek, plus carcinoma or cancer. For malignant mesenchymal tumor, plus sarcoma. For embryonal tumors, plus blastoma. Exclusions: melanoma. Melanoma, we hear benign, name oma, but this tumor is very, very malignant. Seminoma, we hear benign tumor, but this tumor is malignant. Tumors classifications. There are several classifications of tumors. First classification according to the clinical course, benign and malignant. We talked about different types of tumors, and this classification is very important. The next classification according to the process dissemination, TNM, where T primary tumor node, N regional, metastasis present or absent, and M remote, metastasis present or absent. In those scheme, you can see examples of TNM classification in the cancer of the lung. T1 is peripheral node and small size. T2 with the growth in the bronchial tube. T3 growth in the large bronchi. And T4 growth in the trachea. And 1, 2, 3 present of lymph node metastasis, and M1 with the present of hematogenous metastasis in the liver. The next classification according to the histogenesis. From which cells we see growth of tumor? From the epithelial cells is very, very often type of tumors. From the mesenchymal tissues, from the melanin-forming tissue, from the nerve system tissue, tumors of the blood system, and teratomas. Before describing of all tumors, I want to tell you tumor description scheme. If you want to describe all tumors, you must to tell about localization of tumor node, outward appearance, what this is, node, is a plaque, is a cyst, etc. The next, you must to describe microscopic description. Which size, which form, consistency, borders, and color on incision. And microscopic description, characteristic and presence of the tissue and or cellular etipism. And more about different types of tumors. At first, about epithelial tumors. Epithelial tumors can be organ-nonspecific without a specific localization, and organ-specific tumors from the cells of a certain organ. And more about each of them. At first, organ-nonspecific epithelial tumors. There are 3 types of these tumors in this group. From the squamous and transitional epithelium, from the glandular epithelium, and from the cambial embryonal cells. Tumors from the squamous and transitional epithelium. Benign has name papilloma. Malignant, squamous cell, keratinous and non-keratinous carcinoma, or transitional carcinoma. In this photo you can see papilloma in the skin. Small size, as a papilla, as a berry, and color as a skin with clear borders. Histologically, we see differential mature squamous cell with keratinization with growth as a papilla. In this photo, you can see squamous cell carcinoma with keratinization in the skin, and histologically, we see atypical cells, the complexes of atypical cells with keratinization, or cancer perils. Look, this cancer perils and atypical complexes. In those pictures, you can see squamous cell carcinoma with keratinization, with keratinization, with keratinization, and without keratinization. Non-keratinose. Non-keratinose cell, squamous cell carcinoma is more malignant. The next group, tumors from the glandular epithelium, from glands, benign, has name adenoma, malignant adenocarcinoma. In this photo, you can see many glandular polyps in the intestine. Histologically, we see growth of many glands with normal mature epithelium. And in this photo, we see malignization of glandular polyp and formation of adenocarcinoma. Atypical cells and abnormal glands. Cells are hyperchromical, multinuclear, multiform, and atypical with pathological mitosis. And the last, tumors from this group, tumors from the cambial embryonal tissues. Cambial embryonal cells are atypical cells, that's young cells. As a result, benign tumors we can't see. There are no such tumors. We see only malignant and non-differentiated forms of cancer. Medullary, soft, sclerose with growth of connective tissue, signet ring cell carcinoma, small cell carcinoma, solid carcinoma. In those photos, you can see non-differentiated cancers. We don't know which the cells. It's very atypical and not differentiated tumors. The next information about organ-specific epithelial tumors. In all organs, we can see cells with epithelial origin. For example, in the liver, there are hepatocytes. Benign tumor has name adenoma or hepatoma, and malignant hepatocellular carcinoma. In this photo, you can see adenoma of the liver with clear borders and small size, and green color is a result of coloration by bile. And in those photos, you can see malignant tumors and histological examination of malignant tumor, liver carcinoma, hepatocellular carcinoma. In the kidneys, epithelial region have tubular epithelium. Benign has name adenoma and malignant renal cell carcinoma. In this photo you can see renal cell carcinoma. It's different colors, round form and growth in the surrounding tissues. This clear cell renal cell carcinoma with presence of fats and yellow color. In the mammary gland, from the epithelium of alveoli and excretory ducts, benign has name fibroadenoma and malignant breast cancer or mammary gland cancer. From the epidermis of breast, nipple and areola, there are not benign forms, and malignant tumor has name Paget cancer. In this photo, you can see fibroadenoma, solid elastic consistency, white color and clear borders. Histologically, we can see growth of connective tissue fibro and growth of ducts, pericanalicular, around ducts, and intracanalicular growth into the ducts. In this photo, you can see cancer of the breast and histological forms. Lobules in the ducts. We see atypical, hyperchromical, abnormal cells. Paget cancer, macro picture and histological examination. We see Paget cells, clear cells. In the adrenal glands, from the cortical layer cells, benign has name adenoma, malignant adrenocortical cancer. From the medullary layer cells, benign pheochromocytoma and malignant pheochromocytoma. In this photo you can see adenoma of adrenal gland, yellow color and round form and clear borders. And histologically we see clear cells of adenoma. In this photo you can see brown pheochromocytoma from the medullary zone. In this photo, adrenal gland cancer in the adrenal gland. The next group of tumors from the mesenchymal tissues. And at first, I must to describe you tissues derivates of mesenchyma. From connective tissue, from adipose tissue, from vessels, blood or lymphatic, muscle tissue, bone tissue, and cartilage tissue. Tumors from the connective tissue. Benign has name fibroma, may be solid, may be soft. In the solid we see growth of connective fibers, in the soft growth of cells. Malignant fibrosarcoma or polymorph nuclear sarcoma. In this photo you can see fibroma in the finger, fibroma in the tongue. Histologically, we see growth of connective fibers, is solid fibroma, but chaotic growth and plus tissue. Fibrosarcoma more often is localized in the extremities, retroperitoneal space. Dimensions large, borders indistinct. On incision we see fish flesh or many colors. Fish flesh means sarcoma, sarcos, fish meat. And consistency may be solid as a fibrosarcoma and may be soft as a polymorph nuclear sarcoma. Look, in this photo you can see many nodes of sarcoma, histologically abnormal atypical fibroblasts, hyperchromical multinuclear. Tumors from the adipose tissue. Benign has name lipoma, malignant liposarcoma. What about lipoma? Localization more often under the skin of the extremities, in the back, in the belly. Node of any size, of yellow color, flabby consistency with distinct borders. Histologically consists of fat lobules of various dimensions and forms. Adipocytes are normal. Node about 3 centimeters of yellow color and normal adipocytes. What about liposarcoma? Localization more often in the retroperitoneal space. Growth is slow. Lipoma malignization is possible. Dimensions more than 10 centimeters are potentially dangerous in view of liposarcoma. Look, in this picture you can see liposarcoma, large node, histologically on incision. We see the fish flesh on incision and yellow color with presence of fats. Histologically abnormal atypical cells with fats, special staining, Sudan's free, orange color. The next, tumors from the vessels, benign, hemangioma from blood vessels and lymphangioma from lymph vessels, malignant, hemangiosarcoma and lymphangiosarcoma. Hemangioma, localization more often in the skin and the liver, more often in the children, in childhood, growth with local infiltrating and variants capillary, cavernous or mixed variant. In this photo you can see hemangioma of the head skin in the child. Histological examination is cavernous hemangioma in the liver, large cavernous with blood. Hemangioma, localization soft tissues of the neck and head, node of yellow color with distinct borders. Variants capillary and cavernous. Look, in this photo you can see macro preparation of lymphangioma, yellow color, and many lymph vessels. Malignant tumors from the vessels are found extremely seldom, are growing fast and infiltrate in the surrounding tissues. Fast dissemination through blood, circulatory and lymphatic systems. The next information about tumors from the muscle tissue. Benign, rhabdomyoma from the transverse striate muscles, leiomyoma from the unstriped muscles, and malignant rhabdomyosarcoma and leiomyosarcoma. Rhabdomyoma, a rare tumor, more often is found in the childhood, and localization more often in the head, nasopharynx and thick muscles. Node has a red-brown color with distinct borders. Look, in this photo you can see rhabdomyoma of the heart. Leiomyoma, localization more often in the uterus of 30-50 years old women, can appear in any organ. Can be multiply anatomically, whitish color, distinct borders. Histologically, consists from mature unstripped muscle cells and connective fibers, fibromyoma. Look, in this scheme you can see several fibromyomas of uterus and histological examination with growth of connective fibers. Malignant tumors from the muscle tissue are found extremely seldom. Localization: retroperitoneal space, in the uterus, leiomyosarcoma, in the head and the neck, rhabdomyosarcoma, and unfavorable prognosis. In this photo, you can see rhabdomyosarcoma of the forearm. Tumors from the bone tissue. Benign has name Osteoma, malignant osteosarcoma. Ewing sarcoma we see only in the childhood, in the tip. What about osteoma? It's developing both in cortical, tubular, and spongy trabecular bones, more often in the cranial bones. We distinguish the cancellous and tubular osteomas. The disorderly growth of bone, beams, and connective tissue is characteristic for it. Look, in this photo you can see osteoma of the finger phalanx, yellow color. Osteosarcoma more often appears in the childhood and youngs. Pathology of the 13th chromosome is characterized for it. Localization: long bones in the thin bone, in the cannon bone. Ewing sarcoma in the children only. Translocation of the 11 to 22 chromosomes is characteristic for it. Osteosarcoma of the teen. The next, tumors from the cartilage tissue. Benign has name chondroma, malignant chondrosarcoma. What about chondroma? A solid tumor of the whitish color, looks like a hyaline cartilage. The borders are distinct. Localization: hands, feet, vertebrae, sternum, pelvic bones. Consist from chaotically located major chondrocytes, which, however, sometimes have 2-3 nuclei. In this photo, you can see osteochondroma of the rib, chondroma of the shin bone. Histologically, you can see normal chondrocytes, but maybe 2-3 nuclei in those chondrocytes. And chondrosarcoma is marked out by the infiltrating growth, is growing slowly with late dissemination, and chondrocytes are atypic. And in this photo you can see chondrosarcoma of the shoulder blade. The next information from the melanin forming tissue. Tumor source: melanocytes. Localization: basal layer of epidermis, hair follicles, mucous membranes, pia mater of the brain, retina and iris. Benign formation, not neoplasm. Benign formation is nevus, is a typical abnormality of the skin, and malignant melanoma. What about nevuses? Are localized in the skin in the form of protruding growth of brown color. Histologically, we distinguish epidermic, dermic, intradermal, complex, juvenile spindle cell, blue nevuses. In this photo, you can see anatomical picture of nevus. Histologically, growth of nevus cells with melanin. In this photo, you can see intradermal nevus. What about melanoma? Extremely malignant tumor with a fast and wide dissemination. Can develop from the nevus. Anatomically, blue-black node with inflammation, hemorrhages, decomposition without distinct borders. Histologically, spindle shape or polymorph cell contain melanin. Look, in this photo you can see anatomical picture of melanoma. histological abnormal melanocytes with melanin. Abnormal hyperchromical, multinuclear, multiform cells with brown melanin. The next information about tumors of the nervous system and meninges. Which common feature of tumors of this localization? Variety of clinical morphological forms of tumors from nervous system. More often are found in the childhood. Malignant tumors are disseminated seldom and only through the liquor canals. Even benign tumors are considered malignant because they can compress the vital centers of the brain. Classification of tumors of the central nervous system. Many tumors and groups in this group of tumors. Neuroectodermal, from the cells of central nervous system. Meningovascular, tumors of the meninges. Tumors of the cranial and spinal nerves. First group, you can see many tumors. It's very difficult and different tumors. Astrocytic, oligodendroglial, tumors of ependyma, tumors of chondroid plexus, neuroglial tumors, many groups, pineal tumors, embryonal tumors, medulla epithelioma, neuroblastoma, retinoblastoma, medulloblastoma, many groups. In those pictures, in those photos, you can see examples. Astrocytoma of cerebellum. This benign tumor, but this tumor leads to the death as a result of localization in the cranium, in the cerebellum. Pons cerebelli astrocytoma. Histologically, this benign tumor, but even this tumor leads to the death. Glioblastoma is malignant tumor of central nervous system. It's a typical cells. Medulloblastoma of the cerebellum with hemorrhages, with necrosis. Leukocoria, a white color reflex in the right eye in case of retinoblastoma. Retinoblastoma, growth of tumor in the eye. Histological examination of retinoblastoma with formation of rosettes, Flexner-Wintersteiner. Neuroblastoma, tumor from adrenal glands. The next group of nerve system tumors, tumors of the meninges, tumors from meningoepithelial cells on meninges, non-meningeal tumors from the meninges, many tumors. In this photo, you can see Hemangioma. This benign tumor, but this tumor leads to the death of patient as a result of pressure of the brain. The next group, tumors of the cranial and spinal nerves, schwannoma, neurofibroma, malignant schwannoma, many tumors. I repeat. In this photo you can see schwannoma. And thanks for your attention. That's all information for you. Goodbye.